cost to rub whatever the fluoride on your dental, and how often you have to do that to have good success with dental hygiene?
Can you repeat? I didn't catch the first part.
If you, what does it cost to put the fluoride on your teeth versus drinking lots of water? How much does it take? How much water does it take with fluoride? And just rubbing this stuff on your teeth, how much water do you have to drink to get the same amount, the benefit?
I probably need to defer that question to our public health dentist. I would see those as complementary approaches. The fluoride varnish is very helpful, especially for kids who don't have access to fluoridated water. The problem is that many kids living in poverty don't have access to that.
With the Department of Health, is that a treatment that you give when you see a child that needs dental care to have good health? Can you not rub that fluoride on their teeth?
Yes, we do have a program to put fluoride varnish, but they don't necessarily come into the health unit for that.
But if families had that option and they knew they had that option and they were in critical need of help, then the Department of Health is going to take care of them, correct?
Well, not everyone has a local health department in their community. We have at least one in every county, but it doesn't mean they have it in their town.
True, but they would have access, just like we would if someone were going for other needs, or they would be able to have access if they needed it, though, correct?
Of course, parents would have to take time off work and drive their kid if there were transportation problems. And many of our citizens, they don't have access to good transportation, so there are some challenges there.
There are, but we also have schools. Does the health department still not come to school anymore?
We don't come to school for the varnishes at this time, no.
Okay. And I knew that we gave, a few years ago, we gave the nurses there, didn't we, the ability to put fluoride on their dental at school?
That's correct. Now, if that were done on a very widespread basis, it would cost the state. Actually, it would cost more than fluoridating the water. I
purchase bottled water, so I don't have to drink whatever's in it. Sometimes it tastes horrible, depending on what city you're in. I have well water at my home, and there's some water just stinks when you don't drink it. It just has this odor that I mean, different waters. I mean, it's different everywhere you go.
That's correct.
And sometimes it tastes like bleach or smells like bleach. When you drink it, it's just really not palatable. You're not going to drink it. So if I purchase water, as Senator Clark alluded to, our chair, about people buying water, if I'm paying for water myself, think about how many people are really buying water. I think you need a study on that. First of all, if you're going to use those numbers, I think you need new data, because some of the beverage places got water everywhere. People are buying it and paying pretty high price for good, clean water and less fluoride in it and less other things. So I look for spring water is what I look for when I buy it. But so I would like to know what the cost, and you might want to bring your other expert, if you could, to answer my questions. Would that be okay, Senator Clark? Is the cost. We need to know what it costs to put it on your teeth versus having to drink years worth of water to get the same benefit.
I have my state public health dentist here, Dr. Lindy Boland. Can he come and address some of those issues?